Last week you saw as Dr. Mehmet Oz took me into his operating room where he performed open heart surgery, bypasses, valve replacement. But Dr. Oz is also a trailblazer in America exploring treatments that don't require picking up a scalpel. It's called complementary medicine. It combines conventional care with some of the methods from the East, and it's all over mind-body health, sometimes just the music of life.
All you need is love.
Is this really a world-famous heart surgeon in a kind of hospital campfire sing-along? Don't be fooled, he's on the job.
Dream a little dream of me.
These patients have all had open heart surgery, and as they sing with Dr. Mehmet Oz, they're part of a medical adventure in healing and breathing.
We used to spend hours asking folks to take deep breaths.
Right.
But this accomplishes that goal.
Thanks to Dr. Oz, every patient recovering from heart surgery at Newark Presbyterian Columbia Medical Center is offered the chance at massage therapy and cranial touch therapy to stimulate the flow of energy, on the chance that something we don't know about Eastern medicine can make all the difference.
I actually think energy medicine is the forefront of healing. That's what life is, by the way. It's purely defined by energy. And in many societies, their healing systems are built around that belief.
As you can imagine, the highly respected high-tech surgeon is sometimes a lone pioneer, while his other high-tech colleagues roll their eyes. I can't believe that you don't feel radiating off for a lot of your colleagues, the idea that you are a woo-woo whack job with some of this.
Yeah. I'm sure people think that I'm out in left field, playing by myself.
But before you make up your mind, consider this. Every year, Americans spend $34 billion on the search for alternative or complementary treatments. Even the National Institutes of Health are looking into acupuncture to aid in vitro fertilization and massage as a treatment for depression.
And I think that we're beginning to globalize medicine now. You have to take Eastern approaches and bring them to the West and share West with the East.
A bridge between two worlds arrived at naturally. As a son of East and West, he spent much of his childhood in his parents' native Turkey, European border with the Orient.
It's a unique country because it truly bridges the East and the West. People who believe in integrative medicine and people who believe in high-tech conventional medicine.
His father is also a physician.
My father is from Konya, which is like being from Nashville in Turkey. My father's family is very poor. My mother's family is very affluent. They're still married.
Were you the smartest little boy in the class?
I tell you, I was a bad student in elementary school. I was always bouncy, but I think in many ways that's probably one of the reasons that I've been successful as a surgeon. I was so impatient, I didn't want to wait for someone else to figure out how to fix the problems I was trying to address, so I would just create the inventions myself.
His wife Lisa is the daughter of a heart surgeon who was called the rock doc for playing music in the OR. Dr. Oz does too.
I'd play something really, high energy, Born to Run, Springsteen or something, just to get it jazzed up as you're opening the chest. So you turn the buzzsaw on. In academic medicine, the reason we stay here is to be able to push the barriers of modern thought.
And Dr. Oz says, remember that many so-called scientific procedures were once experimental. Here, he pours a pail of cold saline into the chest cavity of a bypass patient to cool the heart. And what about the mechanical pumps, now standard practice?
When we first started doing these procedures, which have become fairly mainstream now, they were called the Dracula of modern medical technology. These have become the norm.
Two ways of looking at medicine, one surgeon, one goal, healing the body with the help of the soul.
I really think it would be cowardly to pull back and not challenge the status quo when the status quo may not be the right way for the field to go.
Dream a little dream of me.
And Dr. Oz's show premieres on September 14th, as you probably know, and he joins us now. I don't think American Idol is going to be calling us anytime soon.
Certainly not me.
Right, can we go back and redo our singing part? Anyway, you really do think that there are ways that we can avoid some of the medications, that we can avoid some of the stress, the insomnia in our lives?
These are the lessons from my patients. Those little titanium hearts that we were showing in that little clip, we were putting those in the patients. And folks would have the surgery and they come back and say, you didn't make me feel whole. Where's the rest of the wellness package? So I said, what are you talking about? I just fixed your heart. He said, no, that's just a part of the machine. Give me the rest of the stuff. And by the way, that's what holds us back in America. It's the insomnia, the depression, and which of course manifests themselves in things like hypertension that often hold us back from reaching fulfillment.
Let me take some specifics then. What would you do? What would you say to everyone out there who has trouble with insomnia, horrible stress?
Well, insomnia is a great example because it is a litmus test for how well you're coping with life. So, give me your wrist, if I can borrow it.
All right.
And I'll get one little dab here. This is aromatherapy. This is lavender. Now, lavender has actually been used in multiple studies. I won't put much on, but it gets absorbed through your skin and, of course, into your nose. Now, now, what it does, it's really cool, and this is where the science is catching up to the complementary medicine, is it actually bypasses the surface of your brain, the outer part of your brain. It does all the thinking. It goes right into the reptilian part of the brain. So it actually makes you feel viscerally very different. It reminds you of memories far distant in your past that can actually make you feel calm, and it's been used for that purpose to get people to go to sleep more comfortably. And here's the catch. You know, you may still need medications once in a while. It's not about getting rid of all the medications. It's about trying to reduce them as much as possible, thus avoiding any complications and the drug-drug interactions.
Well, in a way, you... No, that was a joke, sorry. But in a way, you train yourself, too, to think of this smell as the sign to calm down, so that in that sense you have a reflex for it. But let me ask about depression. We know about herbs for depression. You think they really work? Is there something else?
Well, here's the big catch with depression. And again, it's a term that's so large, so big. Medications are effective for some people, but medications almost always work better if they're used in conjunction with other support. Psychotherapy is sort of the classic example, but complementary medicine of many types has come to the rescue, and the best example really is meditation. Now, I've got a scan for you to show you what goes on. On the left side of this image, you'll actually see the reptilian brain lit up in red. This is a functional scan. It's a PET scan of the brain. On the right side is after meditation what happens. You notice that red area is gone? That red area, Diane, is the fire alarm. It's going, yeah, bad problems. Things are coming at you. Be careful, duck. Now, that's surviving for us. It's an important, as a helpful tool. But when you can get rid of it through meditation, you can calm the brain down. So for problems like depression, which are primarily about that, about being paralyzed because you're so worried about the world outside of you, it gives you more plasticity, more flexibility, and does the same thing, guess what, for hypertension. If I was hypertensive right now, the number one thing I'd learn how to do is meditate, because it's been shown in randomized trials to be effective.
All right, well, go online. You can always get more information there.